University of Western Australia School of Psychiatry and Clinical Neurosciences Award for Excellence in Rural and Remote Mental Health. People living in rural and remote areas often face significant challenges to accessing appropriate and timely services as a result of geographical isolation. This category recognises an outstanding contribution by an individual, group or organisation to improving the mental health of rural and remote communities. The finalists are the Regional Men's Health Initiative, delivered by Wheatbelt Men's Health Incorporated. The Regional Men's Health Initiative aims to empower men and communities to take responsibility for their well-being, promoting a community-driven approach to resilience. Staff attend field days and other community social functions to offer free health awareness checks as part of the initiative's Fast Track Pit Stop program. The Fast Track Pit Stop Health Awareness Check involves three aspects. Chassis: measure the client's waist to see if they are carrying excess fat around the stomach. Oil pressure: blood pressure is taken. If either chassis or oil pressure is outside of the norm, the initiative offers advice and encouragement on how to regain control through diet and exercise. And shock absorbers: 10 preset questions that are asked to determine how someone is coping emotionally. If any of these questions identify distress, then the participant is encouraged to discuss what problems in their life may be causing them distress. Rural Community Support Services. Rural Community Support Services is a rural primary mental health service based in Narrogin, but servicing over 25 shires and communities across the Wheatbelt and Great Southern regions of Western Australia. The service is focused on building resilience, reducing stigma associated with mental health issues, and providing effective primary mental health services to communities that have difficulty accessing mainstream health services due to geographic location. Rural Community Support Services offer free counselling in the form of brief therapy and short-term supportive counselling for up to 12 sessions per person. The service provides outreach support to individuals and families, whilst also providing advocacy on behalf of clients with non-government and government agencies. Rural Community Support Service provides community education and primary mental health interventions, encouraging individual, families and whole of community approaches to adopt and modify behaviours to better manage their social and emotional well-being. Rural in Reach program at Women's Health and Family Services. The first of its kind in Western Australia, the Rural in Reach program is a statewide program providing a range of healthcare and support services in remote and rural areas of Western Australia. All services are offered at no or low cost and are tailored to meet each community's specific needs, aiming to promote good health as more than being free from disease, with a focus on overall well-being. Rural in Reach works in partnership with regional women's health centres and more than 40 community resource centres. These centres are friendly, locally owned and operated centres that provide regional communities and their visitors with access to technology, information and face-to-face individual and family counselling services with trained professionals in real time. Services are available to women and their families, with consideration made for the unique needs of Aboriginal, migrant and refugee families, as well as local service providers. These services can be based on medical health, alcohol and drugs, family and domestic violence, mental health, community development and Aboriginal family support.